October 1st marked the most significant change in healthcare reform with the rollout of the Affordable Care Act. It's also making hospitals find new strategies for emergency care. Reporter Christy Wilcox is at Torrance Memorial with more.
With the official onset of the Affordable Care Act here in California, hospitals are trying to give the uninsured the opportunity to work with their primary care providers in place of using the emergency room as their source of care. Healthcare reform has officially opened its enrollment, and the debate as to how well it's going to work continues.
There's been a lot of resources devoted, and I think we should try it and give it every opportunity to succeed.
While some believe we should give it a chance, others see trouble brewing.
There's a fine if you don't have, that's going to be imposed if you don't have the actual health insurance. I mean, we have people that don't pay fines for parking tickets.
Happy or not, it isn't just individuals who need to build healthcare strategies, because hospitals also have to take a new approach to emergency care.
The Affordable Care Act has encouraged hospitals and doctors to only admit patients to the acute floors when there is evidence-based criteria.
Now, when patients return to emergency care more than twice in 30 days, hospitals get penalized. According to a recent study by Truven Health Analytics, 71% of emergency room patients don't belong there.
Really encourages them to self-manage and to utilize those same resources, as opposed to maybe a few months ago they went to one doctor and now they're going to a separate doctor.
Now, this medical center is one of the largest hospitals in LA County, collaborating with other facilities to keep non-urgent care patients out of the emergency room, giving physicians the opportunity to care for the right patients.
If it's a runny nose or a mild ache that's been going on for 3 months, you don't really need to come to the emergency department. Sure, we'll take care of you, but at the same time, we got to be taking care of the people having heart attacks and strokes and broken bones.
And once the Affordable Care Act begins on January 1st, this proactive approach to post-acute care will prevent hospitals from paying an extra buck, while also forcing patients to make better choices.
In theory, it's intended to provide people with basic health care so that if they have the flu or something that's not an actual emergency, they'll actually use a physician or a healthcare provider rather than end up in the emergency room. Whether that in fact happens is yet to be seen.
Now, I talked to Dr. Nakim here at the Emergency Services Department in Torrance Memorial, and he was saying that they have about 5,000 patients that come in here every single month, about half of which do not really need emergency services. They're just trying to find the right spot for them. Reporting for City Cable, I'm Christy Wilcox. Back to you in the station.
Thanks, Christy. To learn more, go to coveredcalifornia.com. People from all walks of